Greetings. Today we will explore the question, can low electrolyte levels cause headaches, dizziness, or brain fog? Oh, you bet they can. And if you've been chasing these symptoms with painkillers, extra sleep, or yet another wellness latte while ignoring the mineral bankruptcy happening inside your cells, allow me to redirect your attention to the actual problem. Headaches, dizziness, and brain fog are three of the most common complaints in modern medicine. They're also three of the most frequently mismanaged. Doctors hand out prescriptions, order MRIs, and send you home with a pat on the back and a drink more water. But what if the real issue is that your body is desperately low on the very minerals that keep your brain hydrated, your blood pressure stable, and your neurons firing properly? Let's dig in. I'm the digital avatar of Dr. Max MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired extensive specialized health-related knowledge that he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now let's get back to today's topic, but before that, I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. Your brain is roughly 75% water, and maintaining proper hydration inside and around brain tissue is directly dependent on, drumroll please, electrolytes. Specifically, sodium. Sodium is the master regulator of fluid balance in your body. When sodium levels drop too low, hyponatremia, water shifts into cells through osmosis, causing them to swell. When brain cells swell, even slightly, the result is a pounding headache and, in severe cases, confusion, seizures, or worse. This is exactly why people who drink massive quantities of plain water without replacing sodium, looking at you, overzealous hydration enthusiasts, often end up with headaches instead of feeling refreshed. Ironic, isn't it? You drank all that water to feel better, and your brain is punishing you for it. Magnesium deficiency is one of the most well-documented and yet chronically overlooked triggers for headaches, including migraines. Magnesium helps regulate blood vessel tone and neurotransmitter activity. When levels are low, blood vessels in the brain can constrict and spasm, inflammatory signaling increases, pain receptor sensitivity goes up. Multiple studies have shown that magnesium supplementation can reduce the frequency and severity of migraines. Yet how often does your doctor suggest magnesium before reaching for the prescription pad? Exactly. Low potassium can contribute to tension-type headaches through its effects on blood vessel dilation and nerve function. It also influences blood pressure, and blood pressure swings are a well-known headache trigger. Dizziness is your body's alarm system telling you something is off with either your blood pressure, blood volume, inner ear function, or brain perfusion, and electrolytes play a role in all of them. Blood pressure and blood volume. Sodium and chloride are the primary regulators of blood volume. When these minerals are depleted, whether from excessive sweating, poor dietary intake, or diuretic use, your blood volume drops. Less blood volume means less blood reaching your brain when you stand up, which manifests as that lovely lightheaded, room-is-spinning sensation known as orthostatic hypotension. Ever stood up too fast and nearly blacked out? That's not just a quirky thing your body does for fun. That's a red flag. Nerve signaling. Your vestibular system, the inner ear balance mechanism, relies on proper nerve signaling, which depends on adequate sodium, potassium, calcium, and magnesium. Disrupt those, and your brain gets conflicting signals about where you are in space. The result? Dizziness, vertigo, and a general sense of the floor is not where I left it. Muscle weakness. Low potassium and magnesium can cause muscle weakness, including in the muscles that stabilize your posture and gaze. This subtle instability can contribute to a persistent sense of unsteadiness that people often describe as dizziness. Brain fog. That frustrating state where you can't think clearly, forget why you walked into a room, and struggle to find words that were in your vocabulary yesterday is one of the most common complaints in modern health. And while it has many potential causes, electrolyte imbalance is a major and massively underappreciated one. Sodium and potassium are responsible for generating the action potentials that allow neurons to communicate. When these minerals are out of balance, neural transmission slows down. Your brain doesn't crash like a computer, it just gets laggy, like running a modern operating system on a 2005 processor. Magnesium regulates NMDA receptors, which are critical for learning, memory consolidation, and cognitive flexibility. Low magnesium essentially turns down the dial on your brain's ability to form new connections and retrieve stored information. Calcium triggers the release of neurotransmitters, the chemical messengers that carry information across synapses. Insufficient calcium means incomplete or delayed neurotransmitter release, resulting in sluggish cognitive processing. And remember, magnesium controls calcium channels. Dehydration from electrolyte imbalance reduces cerebral blood flow. Your brain needs a constant, robust supply of oxygenated blood to function optimally. Even a 1 to 2% reduction in hydration status has been shown to impair concentration, working memory, and mood. So that afternoon brain fog you keep blaming on just being tired, it might be your brain literally gasping for minerals. 1. Stop guessing, start testing. Standard blood panels are a start, but they often miss the picture. Intracellular mineral testing and comprehensive metabolic panels give a far more accurate view of what's actually happening inside your cells. 2. Prioritize magnesium. If you do nothing else, address your magnesium intake. Most adults are deficient. Aim for 1,000 milligrams per 100 pounds of body weight per day from multiple bioavailable forms. Magnesium glycinate, excellent for relaxation, sleep, and general replenishment. Magnesium threonate specifically crosses the blood-brain barrier, ideal for cognitive support. Magnesium taurate, great for cardiovascular and brain health. 3. Balance sodium and potassium. Don't just add salt, make sure you're getting adequate potassium too. The ideal dietary ratio is roughly 2.1 potassium to sodium. Most Americans have this completely inverted. 4. Hydrate intelligently. Stop mindlessly guzzling plain water. Add a pinch of sea salt, a squeeze of lemon, and consider an electrolyte supplement, especially first thing in the morning and during after exercise. I formulated and made one of the top electrolyte replacements on the market, perhaps the only one that contains sufficient magnesium. More information to follow. 5. Eat real food. Leafy greens, avocados, nuts, seeds, bone broth, wild caught fish, and quality salt. Your grandmother's diet was probably better for your electrolyte status than whatever trendy protocol you're following now. 6. Consider advanced delivery methods. If you have digestive issues or severe depletion, many of the standard oral supplements may not cut it. In extreme cases, intravenous or liposomal delivery may be needed for limited amounts of time. Having been at this for over 45 years, I've seen thousands of products come and go. About 20 years ago, I began formulating my own supplements. One of the top things I came up with is a magnesium-rich electrolyte powder with multiple forms of magnesium. Magnesium is one of the most common nutritional deficiencies around, and most electrolyte formulations do not have sufficient amounts. The two products I developed are Mag 10X and Mito Energy Y, which is Mag 10X plus a comprehensive B complex. These products are in powder form and can be added to water. I like to add them to naturally flavored coconut water like Bai. This allows you to sip it over 60 to 90 minutes for maximum absorption with minimal potential GI side effects, such as extremely loose stools. You can find these products on either of my websites, ARTC Health or MyBodySymphony.com. Yes, low electrolyte levels can absolutely cause headaches, dizziness, and brain fog, and not in some vague theoretical way. The mechanisms are well established, the science is clear, and the solution is often far simpler and cheaper than the medications and interventions people are being sold instead. Your brain is an electrochemical masterpiece. Feed it the minerals it needs, and it will reward you with clarity, focus, and the absence of that dull, throbbing reminder that something is wrong, or you could just take another ibuprofen and hope for the best. Your call. If you're dealing with chronic headaches, recurring dizziness, or persistent brain fog that won't quit, and you've already tried the basics, it's time to dig deeper. These symptoms can be signs of more complex issues, including hormonal imbalances, poor circulation, mitochondrial dysfunction, or chronic inflammation. The Age Reversal Technology Center, ARTC, in Sarasota, FL, is designed for exactly this scenario. With over 50 years of combined physician experience, they specialize in exactly this kind of detective work using advanced diagnostics, metabolic support using nutrients, hormones, and peptides, oxygen therapies, and comprehensive health optimization strategies and brain health protocols. It's the difference between putting tape over the check engine light and actually opening the hood.